here we can see one case study. In the case study analysis, it is a bow tie type model question. Here we can see the question here. Okay, so here it is the scenario. This is a case study analysis. Okay, this is the nurse's note, and this is the vital signs. This is the lab value, and this is the question. Here we need to understand the question, find out the keyword, and we can correlate with each options and can reach out the correct answer. Okay, so here I will tell you how to understand a case scenario. The first thing, when you are getting a case scenario, you should think that you are the nurse who is giving, or the mentioned nurse is you. Second thing, you can visualize the scenario. Okay, so I am going to read the question and you just visualize it. Okay, the nurse is caring for a 20-year-old client in the emergency department. That means in the emergency department, a nurse is posted in the emergency department. Here she is giving care to a 20-year-old client. Okay, what is the nurse's note? In the emergency department, it is 3 o'clock. Here, what are the complaints in the patient? The client reports feeling lightheaded, dizzy, nauseated, fatigue after attending an event in a hot weather this afternoon. See, here we have to highlight when the symptoms have started, when the client has attended an event in a hot weather. Okay, and this afternoon the client feel, what are the complaints here? Here the client is feeling lightheaded, dizzy, nauseated, fatigue. Okay, and next, the client slept for 3 hours and then woke with severe bilateral knee pain. That means here after this the client slept for 3 hours. Okay, when he woke up after the 3 hours sleep, when he woke up, the client experienced severe bilateral knee pain. See the severe bilateral knee pain, and what is the scale? The score of the pain is 8. 8 is the score. That means in a 0 to 10 pain scale, the client is having severe pain. That means here it is mentioned 8 on a pain scale. And also the client is experiencing severe abdominal pain, mild chest discomfort. Okay, next, medical history includes sickle cell disease. See, the client is already a non-case of sickle cell disease. So you have to think what is happening in a sickle cell disease and what are the crises can be or complications can be occurred in a client with sickle cell anemia. So we have already discussed with the theory the sickle cell anemia, and we know we have to look for whether the client is taking any medications. Okay, yes, the client is taking hydroxyurea, the client is taking folic acid and non-steroidal anti-inflammatory drug. See, the client has a medical history includes sickle cell anemia and also splenectomy. Splenectomy, that means the client had undergone for a sequestration crisis, so the client undergone for the spleen sequestration. Okay, and the client is taking hydroxyurea, NSAID and folic acid. Here the client performs low impact exercises 3 or 4 times per week. Okay, and eats a balanced diet. And lung sounds are clear on auscultation. S1, S2 present. Abdomen is soft, non-distended with a hypoactive bowel sound. Here the only abnormal finding is that the abdomen is non-distended, but the client with a hypoactive bowel sound means the client digestion is not properly. Here it is already mentioned, the client is nauseated. We can look for the vital signs. Temperature 99.1 and yes, pulse rate is 140. We know that it is suggestive of the hypoxia. We know that the normal respiratory rate is 16 to 20, and if it is greater than 20, it indicates that the client is struggling with breathing. Okay, so the respiratory rate is 24. BP is low. We know that 120/80 is the normal BP, but here the blood pressure is 104/54 only. Saturation also 93% on room air. The normal oxygen saturation on room air is 95%, but it is less than the 93%. Okay, so that means the client is having all the symptoms which is worsening with the sickle cell anemia and the complications of the vaso-occlusive crisis. Okay. And in the WBC 7000 normal, HB 7.5 and platelet 1,55,000. These are the lab values we are getting in the client with sickle cell anemia. And also the reticulocyte, the level is 6.2%. That means the level is getting increased in this patient. So we can look for the question. The nurse is reviewing the client's clinical data to prepare the client's plan of care. Okay, that way the client is reviewing with the patient records as well as the plan of care. Okay, and what is the question here? Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. Okay, 2 actions the nurse should take to address that condition and 2 parameters that the nurse should monitor to assess the client's progress. That means this is a board tie instruction question. Okay, here we need to select for the condition. Here we need to select what are the actions to take. Here, after giving care, what are the things we need to monitor. Okay, so once again we can read the question. Complete the diagram by dragging. We need to drag it from this down to here. Okay, dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions should the nurse take to address that condition, and 2 parameters the nurse need to monitor to assess the client's problems. Okay, so we can look for again the nurse's notes. What are the possible diagnoses here? Okay, so it is nurse's note only. It is experiencing the client has a sickle cell disease and a splenectomy. So when there is a sickle cell anemia, there is a risk for vaso-occlusive crisis. We know that the sickled RBC can occlude the blood flow and it can cause vaso-occlusive crisis. So we can correlate with other options also. Is it anything has mentioned about septic arthritis? No. Nothing has mentioned about rhabdomyolysis also. And here nothing has mentioned that SLE. Okay, only the thing it is mentioned, the client is a non-case of sickle cell anemia, and now the client after exposing with a hot weather event, the client experiencing dizzy, nauseated and fatigue. That means the client here exposed to the triggering factor, okay, hot weather. After that the crisis got started to develop. So here we can assume or we can correlate with the other options, and we have taken there may be a possible condition. What is the question here? The condition most likely experiencing. What is the condition here? Vaso-occlusive crisis. Okay, so I given vaso-occlusive crisis here. Second, what are the actions to take? 2 actions we need to select. Okay, we can look for the options also. First thing, synovial fluid aspiration. Is it need to take a synovial fluid aspiration? No, there is no need of it. Okay, administer IV fluid? Yes, of course, because dehydration can trigger the sickle cell crisis. So to maintain the hydration status, we can administer IV fluids. Okay, so we can drag it from here. Next one, administer hydroxychloroquine. Hydroxychloroquine it is not needed for this patient, and here administer opioid analgesics. Yes, of course, we need to look for the pain scale. Here the client is scored here 8 out of 10. So the client need a analgesic supply, opioid analgesics. Okay, collect a blood specimen for the creatinine kinase is not needed for this patient. Next one, what are the parameters? We know we got an idea that the client is experiencing with vaso-occlusive crisis because of this sickle cell anemia, and here we have selected what are the 2 management, administer IV fluid and administer opioid analgesics. See, after the application or implication of this management, what are the things we have to monitor? The first, changes in vision. Is it needed? The changes in vision is not at all the priority need of the patient. Second, then culture and sensitivity. Here the culture and sensitivity is needed, but that is not the priority parameter monitoring. Okay. Next one, hemoglobin. Yes, of course. We know that the client is experiencing with severe sickle cell crisis, so there is a chance for anemia. Okay. So the hemoglobin level needs to be monitored. So I am dragging this hemoglobin here. Okay. Then pain level. Yes, of course. Here the client is already experiencing 8 out of 10. We have administered opioid analgesics. After that, we have to assess. That means whether the pain has controlled or the pain, the client got relief from the pain. Last one, bleeding around the IV site is not a mandatory. That means that is not the priority need of here. Okay. So hope you got an idea how to do a board type format type question. So first you have to look or go through with the theory. After that you can do practice with the questions. Okay, I have read the scenario, I have read the question, understood about the keyword. Okay, what are the keyword here? Here the what is the condition most likely experiencing, what are the nurses to action and to monitor parameters. Okay, so this is the correct answer. We can submit it and we can look for the answer. Yes, this is the correct answer for this question. Hope you got a idea about how we are doing answers and how the question scenario is assessed and how the theory is applied in a case scenario. Okay, thank you so much.